Okay, this video is on the musculoskeletal system. We're going to be overviewing its structure and function. When we do this, we have to go back a little bit to anatomy so that we understand exactly what we're doing and what we're looking for. So when we look at our musculoskeletal system, we are looking at both our muscle and our bone tissue, and we're looking at the area where our bones come together. So, for example, let's take the humerus, for example, and the area where it joins with the radius and the ulnar bone. We're looking at these joints, and what we have to keep in mind is we not only have our bones, but they're being covered by our muscle. Our muscles and our bones are attached by what we call tendons, which are just microfilaments that attach them together. And then also our bones are able to stay aligned by other filaments that we call ligaments. So we are assessing all of these different things when we assess this system. And basically just attempting to see if there's any abnormality, and if so, what could be the cause of that abnormality in order to warrant further testing of them. So we're going to go ahead and go through different regions, starting with the upper extremities, and start assessing it that way. But while we do this, we need to make sure that we understand that we're going to be going through a methodological approach when we do this. And starting off each time as we're assessing, looking at the skin and the subcutaneous tissue, making sure we don't see any masses or swelling, that we don't see any discolorations of the skin, and then we're also going to be inspecting just the symmetry, the contour of the muscles, and making sure that both sides are symmetrical, with no deformities. Also looking at the muscles themselves, making sure that we don't see any atrophy or maybe hypertrophy of them. Also we will be palpating the muscles and looking for any differences or abnormalities in their the way that they look, the way that they feel, and also we're going to be assessing the muscle strength by applying resistance, both assessing active and passive range of motion. And then we're also going to grade the strength of the patient when we apply resistance, anywhere from a 0 to 5 level, 0 being that the patient is completely flaccid and is not able to actively or passively move or move the extremity. And then a grade 5, which would be the patient has full range of motion and is able to apply strength against resistance, both to gravity and to resistance itself. So we're going to go ahead and start off with the upper extremities. When I speak of the upper extremities, I am talking about our hands, our wrists, the joint here of the humerus and the radius and ulnar bone, and our shoulders. So we're going to go ahead and start off with the more distal portion of the extremity, which is the hands and the wrists. Now, quick overview on the anatomy of the hands and the wrists. Starting off here in the fingers, we call these phalanges. Moving in a little further, these are our metacarpal bones. So these are the phalangeal bones, the metacarpal bones, and then we have tiny small bones here at the area of the wrist right below the metacarpals, and these are called carpals. And then of course you have your radius bone here on the side of your thumb, and then on the other side you have your ulnar bone, which is the area here that's on the smaller side of your little finger. So we have different joints here, obviously, that we will be assessing. And when you assess them, first of all, like we had mentioned before, you want to take an overall view of the skin and the subcutaneous tissue. You want to make sure that you don't see any masses, nodules, or discoloration of the skin. And then you want to go ahead and go through and go ahead and begin to palpate. Now, when you begin to palpate, you want to always start off, you want to just look at the fingers, making sure there are 5 in total, that they're complete, that the fingers aren't slightly moving towards another direction, that they're straightforward. Now, keep in mind that you're not ever going to find a perfectly symmetrical hand with all the fingers exactly perfect. So if some of the fingers deviate quite a little bit, I mean in this case where maybe this one's just slightly curved, I mean that's still okay. What you're looking for is something significant. And then you're also assessing the joints here in the fingers, making sure that you don't see any swelling, redness, something that's significant of some type of abnormality. So once you do that, you're going to go ahead and begin to use both of your thumbs to begin to palpate in between what we call the metacarpophalangeal joints. Now, it makes sense if you kind of slow down when you say that. You say metacarpal, which is your metacarpal bones here, and then we had said that these are the phalangeal, so metacarpophalangeal joint. So we're talking about the knuckles here. So you're going to go ahead and begin to palpate with both your thumbs, kind of rotating them around each knuckle this way on either side. And what you're assessing for is making sure that you don't feel any nodules. It should be a smooth surface in between these bones here. So you should ask the patient as well if they're having any tenderness or pain as you're doing this. And then if you see nothing significant here, then you're going to go ahead and move on to the wrist. You're going to do the same thing here in the wrist. Now you will note that you should have a small groove here on the radial portion that you're assessing of that wrist. That's normal. And then you're going to go ahead and go through over to the ulnar side. So again, these must be smooth. There should be no masses, nodules present there. So when you're done doing that, then you're going to go ahead and move on to do range of motion. On range of motion, what you're going to do is, first of all, you're going to go ahead and ask the patient to go ahead and flex the fingers forward, okay? And if you see here, it should be at about a 90-degree angle. When you test range of motion, you're not only testing flexion in this case, you're testing hyperextension as well. So then we're going to hyperextend the fingers all the way back that he possibly can. For example, in this area, you see mine that kind of hyperextend this way. With him, kind of do it as much as you can. That's as much as you can? Okay. So as you can see, mine is a little bit more hyperextended than he is. So that might be a little difference. And then you might see stuff like this happen. You say, oh my goodness, why can't he do it, as much as he should? That's okay, as long as it's functional, okay? So yeah, so he's looking at his other hand. He says that one's better, but that's still okay as long as your structure's okay and it's functioning fine, and he doesn't say he has any tenderness. That's still okay. But normally, when you hyperextend the metacarpophalangeal joint, you should be able to hyperextend it and have about a 30-degree angle. Now, let me go over one thing with you. So, if, for example, you have something like this, and let's say the patient is in pain, the patient is saying that he has tenderness, or maybe you feel an abnormality there. So there is something called a goniometer. Now, a goniometer is similar to a protractor, and you're able to use it to measure the angle at which the patient is able to flex or hyperextend that joint. So in this case, let's say he was complaining of some type of abnormality or symptom when doing this certain type of hyperextension. Well, like I said, that when he places his fingers down, that's at about a 90-degree angle, and then when he moves it up, that would be your baseline, okay? This would be your 0 degrees. This would be 90, and then again, you're at 0, and then I was saying to you, when you hyperextend, it should be about 30 degrees. When you use your goniometer, it should have the different degrees up here. Now, there's different types of goniometers. This is just one of the many. Now, you use this and you place your 0-degree angle, and then you measure to see how far back he goes, and then that's the way you're able to get your degrees, and that's the way you're able to say, hey, out of the 20 or 30 degrees he's able to hyperextend that, he only is able to do 5. So that's the way you're able to assess. So anytime with any joint that you see an abnormality like that, use your goniometer to be able to measure that angle and realize where it is that your base is at, where you're at 0 degrees or 180, okay? And then you go from there. After we assess the metacarpophalangeal joints and we've done the hyperextension now, now we're going to go ahead and test the opposition of the thumb. Now when we do this, we're checking to make sure that this thumb is opposable and he is able to move it adequately. So we're going to go ahead and ask him to touch his thumb with each finger of his hand. And then after he does that, he should be able to touch his thumb to the base of the little finger. And then we're going to ask him to make a fist. And then we're going to ask him to go ahead and what we call abduct his fingers, which is just widen them out, and then adduct, which is bring them in. Now all of these movements should be smooth, should be coordinated. He shouldn't feel any or have any difficulty in doing these. Now also, when looking and inspecting the hand, you want to inspect both the dorsal side and making sure that it looks normal, but also when we look at the palmar side as well, this is a big thing to look for. You need to have a central depression in the middle of the hand, and then also some prominent mounds, especially on the side of the thumb, and then a smaller one on the side of the little finger. And you should be able to feel these with a central depression. So that's something to take a look for whenever you're assessing the hand as well. So we've already assessed range of motion of the metacarpophalangeal joints. Now we're going to go ahead and assess the range of motion of the radiocarpal joint. So when we do this, we're going to go ahead and ask him to flex his wrist. Okay, now that should be able to flex at a 90-degree angle. So it's about at a 90-degree angle there. And then we're going to go ahead and ask him to hyperextend the wrist. Now, we should be able to hyperextend by 20 degrees. So if we put our goniometer there, we should be able to see that it's at about 20 degrees. So then after we do that, we also are going to assess the lateral motion of the wrist, meaning right to left. So when we go right towards the ulnar side, we are always going to have more range of motion that way than the radial side. So the motion to the right should be 55 degrees about, 55 degrees to the right, and about 20 degrees to the left. Okay, so that is the portion of the wrist. Now we're going to go ahead, after assessing the range of motion, now we're going to go ahead and assess the muscle strength. So when we do this, I'm going to go ahead and apply pressure. Go ahead and keep your arm like this. I'm going to go ahead and apply pressure. I'm going to have him apply pressure my way, put force my way while I push back. And then again, the same way, and ask him to hyperextend with resistance. And then I assess the muscle strength that way. And then after that, I'm going to give him 2 fingers, and this is the way I assess the grip. Is I'm going to go ahead and ask him to grip my hand as hard as he can. And always use 2 fingers, because if you use more than that, they're going to break your hand. So I'm going to go ahead and stop there with the assessment of the hand, as we have already completed it, and move on to the area of the elbow next, because I am running out of battery as well. So I'm going to go ahead and stop there. We'll continue with the next video. And 20% battery left. It's a good thing I stopped. It was 14 minutes there.
Oh my god.
Maybe I can put it over here or something?
Nope, keep it over there. Keep it over there. Keep it over there. Charger.
Hey, what time do you have to be back?
Now?
Really?
No.
No, what time do you have to be
here
here?
at like 12:15.
Okay. Well, I just was asking so I know like how much time I have. Jeez.
If somebody would have had their phone plugged in this whole morning, you'd have